Nearly 1 year after Chicago's emergency travel order took effect, it has been lifted. Today, public health officials changed it to an advisory. The move comes as all 50 states remain below the threshold for COVID cases. For the past 3 weeks, no U.S. state or territory has reported more than 15 cases per day per 100,000 residents. All Midwest states have had fewer than 5 cases per 100,000 residents since June 15th. Officials remind everyone that the travel order can be reinstated at any time if cases start to surge.
Meantime, Illinois health officials say there are 103 cases of the highly contagious Delta variant and thousands of other cases linked to COVID variants here in the state.
But is this cause for concern? Dr. Gregory Hune, an infectious disease physician and COVID-19 vaccine doctor for Cook County Health, is joining us now. Dr. Hune, first of all, there are so many different variants, and people, I think, are getting confused. Can you lay out the variants, which ones we should be really afraid of, and which ones probably most of the vaccines will cover?
Yeah, happy to join you. So variants of concern have been defined by CDC as those where we have evidence that there's increased infectiousness. They may have reduced effectiveness to, let's say, therapies or vaccinations, and they may cause more severe disease. So we should be concerned. There's 3 different classifications, and variants of concern are right there in the middle. And the Delta is the latest one that's on the rise. These are mutations in the receptor of the virus that binds to our cells. And if it's increased contagiousness, and if we don't have protection, it tries to slip through our immune defenses and then can cause more and more disease within the community.
They keep mutating. Let's talk a little bit about masks. The WHO came out and recommended that even fully vaccinated people still wear a mask, and that sort of runs counter to the CDC that came out and said you don't need to do that. Chicago also following suit. How do you sit on the fence of that?
So the WHO actually made that recommendation for masks actually for indoors. We know at outdoors there's more social spacing, so not much as at risk for contagiousness. But again, it is important, particularly for those countries that are under-vaccinated. We're in a better position here in Illinois. We've had at least 1 dose of vaccine among 71% of our adults at least 12 years of age, which is the eligibility for the Pfizer vaccine, and about 40% that are fully vaccinated with at least 2 doses. So we're well positioned actually to control and defeat COVID-19, particularly if we step up our game and really get to that point of herd immunity, 70 to 90% vaccination. So compared to other countries, and again, this Delta variant has caused devastation in healthcare systems throughout the world. 77 countries have been affected. It originated in India, really resulted in a surge of severe diseases and actually increased mortality. But here in Illinois, we need to keep our eye to make sure that we are increasing our vaccination efforts at every opportunity. And we have ample supply, ample spots and spaces to actually have access to that vaccine. And so when we really keep up in this race against the variants, I believe certainly by the fall, where we see the variants perhaps doubling with the Delta every 2 weeks, if we increase our vaccination rates, we can actually overcome those surges that we've seen in other states here actually in the U.S., southern states, middle states, particularly in Missouri, as well as Colorado. We can control this by increasing our vaccination rates.
So to be clear, the Delta variant is on the rise, but if you're increasing your vaccinations and if you are vaccinated, you will probably beat it, correct?
That's correct. Right now, the Delta represents about 1% of all the variants that we've been tracking here in Illinois, really since the winter time. And so we need to keep that level low. And the best way to do that is to really snuff out the oxygen for the virus. And the way to do that is to get everybody vaccinated.
I like that analogy. How much are children the variables here, especially teenagers?
Right. So we know that actually the increased rates now, the greatest population are in those 18 to 29, and those persons actually may feel somewhat, let's say, less than vulnerable to the severe aspects of disease and infection. We know, however, just by getting an infection, that actually can put persons at risk for perhaps long COVID, persistent symptoms over a 6-month period, memory problems, fatigue, that loss of taste and smell that can really persist. And in young persons, we really need to have that eligibility, particularly in those less than 12 years of age, hopefully by the fall when we enter into the school years. And so that will actually then provide us great steps to get all those vaccinated to protect the greater pool of our population against the transmission against these variants.
A lot of good info. Dr. Gregory Hune, thanks so much from Cook County Health. We appreciate your time tonight.
Thank you.